Right, well, I'm here talking to Dr. Nina Williams about healthy city status, and Nina's going to be talking to the Our Ambition 7 conference tomorrow about all of this. So I just wanted to ask you a couple of questions really about that. First of all, for people that don't know, what actually is healthy city status?
I'm sure many of you know already that we actually achieved healthy city status about a week ago. And to explain what it means basically it's not a health status particularly applied to a city. What it is that you have a senior political and exec officer commitment to achieve health for all fair health for all in your communities. And that involves a high-level commitment and actually signing something called a Zagreb Declaration, which all political leaders who want to take part in this initiative have to do.
So why do you think it's so important for Swansea to have this healthy city status?
It's an opportune time. We know it's been known for a long time that health inequalities are linked with poor income, and unless you address what determines the social determinants behind health, you're never going to stop the ill health happening. And very much what Healthy Cities does is its main reason for being there is to help cities to reduce those health inequalities that are across the cities, and it's by looking at the bigger level stuff like health in all policies, fair health for all in all policies, starting from very strategic level right down through partnership agreements, just to consider all those who could be affected by avoidable inequalities.
So you're going to be speaking to the Swansea Community Planning Conference tomorrow about healthy cities. What sort of things are you going to be telling people, and in particular what kind of practical ideas might you be giving people about how they might sort of take this agenda forward?
We are in an economic downturn, and I think the important thing is that we've got to try and preserve focus on reducing health inequalities. So some suggestions that have come out from the World Health Organization is to look at communities and what assets you have in the community. How can you build capacity in communities for like skills and literacy skills, ready for when things change in the future. Thinking about new partnerships with people perhaps you haven't engaged with before, particularly private businesses, or can they offer the community and support communities in taking more ownership and changing things. It's very much looking at different ways of how we can engage communities to be more self-sufficient and change the way that their communities are currently, and how we can improve health in those communities. But it's very much cross-party, cross-integrated action.
That's great. Well, thank you very much for that. We'll look forward to seeing what comes out of the event tomorrow.
Thank you very
Nina.
much. Oh.